It is Sunday, April 26th. Joe Delron, you Jets. Welcome to the COVID-19 Task Force Daily Update. It's a Sunday, it's nice, it's not sunny, but hey, enjoy the day and let's make the best of it, as we have been for the past 6 weeks. Well, joining us once again, she took a day off yesterday, well earned. Let's bring back Lisa Westaway from the Kahnawake Memorial Hospital Center for her update. Lisa?
Good afternoon, thank you. You guys are supposed to change this. Okay, I actually I'm laughing right now because of this, but I have a difficult subject to talk about today. So yesterday I mentioned there were some new directives, that there were no new admissions to KMHC. So these are new directives that come from the ministry for important reasons. So I wanted to talk a little bit about those reasons. So what Quebec is seeing, that due to many transfers early on in the COVID-19 pandemic, many transfers from hospitals, from home into long-term care facilities, actually contributed to the state that we're seeing presently in long-term care facilities, meaning the high rates of COVID-19 cases and the high amount of deaths. There are many other variables and elements that contribute as well. However, these transfers are one of the main reasons, and therefore directives have since changed and change on a regular basis regarding admissions to long-term care facilities. You may recall I talked about it last week, that we were allowed to admit from a hospital center if the person had a negative COVID-19 test and would be in isolation for 14 days at KMHC. However, as of Friday morning actually, that is no longer the case. This has significant impacts on our community, and I didn't talk about that a lot when I came here Friday, but I thought that I would talk about it today. If you have a family member who is receiving home care services, for example, and whose situation deteriorates, either requiring palliative care or more nursing services, in the past we would transfer to a palliative care bed at the hospital. However, we are no longer able to do that. So there are different options that are available, and these options should be discussed with your home care team should you be faced with this type of situation. So what are the options? There are options where we could look at increasing our services provided to you in the home so that your loved one is safe and comfortable, and so that your family members also have the support and respite that they require. We could also look at transfers to palliative care facilities. I know that this is not something that anybody wants from our community. We do not want to transfer our loved ones to a hospital outside of Kahnawake. However, that is a possibility should we require it. So of course, our first step would be to try to provide as many services as possible within the home. Of course, those services provided, we have to also respect our COVID-19 measures that we have in place in order to ensure that patient, family members, our staff and our physicians are safe as well. So meaning we will try as much as possible to have the same workers in and out of your home. We'll try to limit the amount of exposure and we'll wear the appropriate protective equipment. So it's not an easy subject, and I am sorry for anybody who is going through this at this particular time. However, the directive is in place right now because of what we have seen across Quebec, across Ontario, across the country really, and the impacts to long-term care facilities regarding these transfers. The information is looked at on a day-to-day basis by the ministry. Our directives change on a day-to-day basis. I will continue to keep you updated regarding these changes and how it might impact your day-to-day situation. But again, our goal is to ensure that that your loved one is safe and receiving the services that they require at home. So we work collaboratively with KMHC and KSCS in order to ensure that that could happen. On another note, I wanted to talk a little bit about the testing site. So tomorrow the testing site will be open at 8:30 for phone calls. However, we will only begin testing at 1 o'clock. So we're in the process also tomorrow of starting to prepare and organize our health checks in the home. So as you recall, last week I mentioned that we're going to be calling everybody in at their home to do a health check and talk to you a little bit about symptoms and if there's a need for testing at the home or in the sector where you live. We will also be organizing that so that we could come to you and provide testing closer to your home. We'll be giving you more details about that as we move forward, but the first step is getting set up to be able to call home. We're aware that not everybody has a landline, and so we'll be having something in place to ensure that you can call us to also have your health check done of your family. So that's the information that I have for today, and I will be back again to see you tomorrow. Thank you.
All right, now go Lisa. All right, Lloyd Phillips also took a little time off yesterday, but rejoins us for the daily update. He is, of course, our Commissioner of Public Safety. Lloyd?
Again, thank you, Joe. Thank you, Lisa. And I just washed my hands before I walked on camera. Like I mentioned on Friday, the message I want to keep repeating to our community is stay the course. I think it's important for us to keep emphasizing again and again to the community that we are on the right path. You know, we're seeing the successes where we want to see the successes, but again, at the same time, no, we're not out of the woods yet. No, we have to maintain our vigilance. You know, we have to make sure that all the hard work that we have done as a community for the past 5 weeks is not, you know, in vain if something goes off the rails, so to speak. So we want to make sure we keep the message strong to the community that we have to stay the course and maintain what we're doing. Because as of today, in Quebec, there have been 1,515 deaths. That's actually above their one of their original projections they made earlier in the month. So unfortunately the death rate is has increased more than they anticipated. And if you look at some of the numbers, and just to ballpark it a little bit, you know, the first half of April, they were averaging about 50 deaths a day. And the second half of the month, mainly the past week or so, almost averaging 100 deaths per day within the province. And unfortunately, most of those are happening right across the river in the Montreal area, and also parts of the South Shore as well are heavily impacted. So just so people are aware that these are things that are still ongoing, because you know, I watched it again. Like I said, I watch the media. I hear what's happening in and around us. You try to get a sense of, you know, the pulse of the community, what people are feeling, what people are thinking. You know, and I just want to reiterate this numbers, which is a little bit morbid to talk about death and 100 people a day dying, but it's a reminder to the community of why we are doing what we got to do, and it's a reminder that, you know, it's right literally, you know, at our back door. You know, a stone throw across the river is where the epicenter of Canada is. So we have to maintain our diligence and be strong. Just another thing, yesterday was a nice day. Today wasn't too bad, but obviously we're hoping over the next few days the spring-like weather will really be upon us and have some nice warm days, and a lot of people getting out, you know, exercising, you know, walking around. We certainly encourage people to take advantage of our great bike paths, walking paths we have in the community. You know, get out there and, you know, get some fresh air. Maintain your physical distancing. You know, like I said on Friday, obviously if you're with your family grouping, that's fine. Hang out together, have fun. But you know, go there, be safe, and just make the best of it. I guess I should say, because you know, I know it's tough, and what I experienced firsthand though. But when you're outside and you're in the sunshine and you're walking around, whatever, there is that sense of normalcy, I think, which we all need a little bit more in our lives. One thing, there was some reports yesterday that there was some non-locals who were in and around the community and on the bike paths and going towards the island and stuff of that nature. They were they were asked to leave. There was some fines issued. So if you do see somebody who's not from the community out and about, by all means, you pick up the phone and call the peacekeepers, and they'll have a car go over there immediately and deal with the person appropriately. Along the same lines, as Dwayne Zachary reported last week, there's been fines issued to people coming to the community to try to purchase tobacco products. And what we're finding now is the people for the most part, people in the immediate area around Kahnawake, they understand the message, they get the message, and they have stopped attempting to come into the community. What they're finding now is people further out, even far as Granby and Sherbrooke area, and people in Terrebonne and communities much further away from Kahnawake. Those are the ones that they're seeing an increase in people who don't normally associate closely, with Kahnawake. So they're being dealt with in the same way. If they're spotted in the community, peacekeepers are intervening. They're getting fines where appropriate, and they're escorted off the territory. So once again, if you see something that you see is suspicious, by all means, the peacekeepers are always available to respond, 24/7 if you see that. Just one point I also want to raise to the community, because I was again watching the media and the news, and you've seen some of the comments made by President Trump last week regarding taking sanitizers or different disinfectants and ingesting them. A lot of people laugh that off at the idiocy that it is, but there has been reports in the U.S. that people have actually been trying that by drinking bleach or by drinking other type of sanitizer, and obviously getting very ill. So please, if you're listening to this, and if that's something that you may have not be clear on, do not drink any type of sanitizer, any type of bleach or anything like that, because there has been obviously reports of it happening throughout the U.S. So with that, this is the time. We've been in this this war, this battle against the virus for a while. It's getting long on all of us. So now's the time to think about yourself. Make sure you find ways to deal with your own personal stress in your life. Whatever works for you. If it's a matter of listening to music and going for long walks, exercise, or whatever you think works best for you, I certainly encourage people to find those activities, because it's been a long ride. We're not out of the woods yet. We're going to be at this for a little while longer. So let's find those ways to relax, and let's make the best out of a tough situation. So like I said before, we owe it to ourselves and we owe it to our elders. So, Kahnawake.
Yeah, thank you very much, Lloyd. And speaking of those elders, if any of our elders are watching this right now or a little later on when it is rebroadcast, by all means, take care of yourselves. We're glad that you're still with us, and we're all trying to work together to make sure that you're with us for a long time to come. There will be some news this week. As we state on these updates, there are certain regulations and actions that are being taken, that have been taken, that will be up for review. Some of those are coming up this week, so you can pay attention for that. Other than that, we wish you the best for what remains of the weekend, and hopefully we'll see you back here tomorrow, roughly the same time. So have a great rest of the weekend. Stay healthy and take care. Kahnawake.